Hi, I am Dr. Jocelyn. I'm about to show you something that could explain why your blood pressure refuses to come down, even though you take your medication faithfully every single day. Something most doctors never mention, something new research revealed just weeks ago. It uncovered 5 critical mistakes people make when taking vitamin D. And mistake number one, the most dangerous one that almost everyone makes, can quietly add 15 to 20 points to your blood pressure reading. After more than 2 decades working with heart patients, I've seen people stuck on 3 or 4 blood pressure medications who were making these exact mistakes with their vitamin D. They were doing everything they were told, taking their pills, following instructions, showing up for appointments, yet their numbers stayed high. The pharmaceutical industry doesn't advertise this. There is no profit in teaching you the correct way to take a supplement that could reduce your dependence on medications. But the research is overwhelming. A large study published in the Journal of the American Heart Association followed over 15,000 people for 8 years. It found that vitamin D, when taken correctly, can lower blood pressure by 10 to 14 points. That is the same effect as adding another blood pressure medication, except this costs pennies per day and has no side effects. By the end of this video, you'll know exactly what these 5 mistakes are. You'll understand why mistake number one is so catastrophic that it can block all the cardiovascular benefits vitamin D is supposed to give you. And you'll have a complete, simple protocol you can start using today. Let's begin with mistake number 5 because this one surprises almost everyone. Mistake number 5 is taking vitamin D without vitamin K2. This is not just about reducing effectiveness. This mistake can actually make things worse by causing calcium to build up in your arteries. Let me tell you about Thomas. He was 71. His doctor discovered he was vitamin D deficient with a level of 18. He was prescribed vitamin D supplements and took them faithfully for 5 years. His vitamin D level rose to 35, but his blood pressure never improved. In fact, it slowly worsened. He started at 148 over 88 and ended up at 156 over 92. Then Thomas developed chest pain. Testing showed significant arterial calcification. His arteries were becoming stiff and rigid. His doctor was confused. His cholesterol was fine. He didn't have diabetes. Why were his arteries hardening so quickly? A cardiologist who had just attended a conference asked him one simple question: are you taking vitamin K2 with your vitamin D? Thomas had never heard of vitamin K2. Here's what was happening inside his body. Vitamin D increases how much calcium you absorb from food. That's good for your bones. But that calcium has to go somewhere. Without vitamin K2, calcium can settle in soft tissues, including the walls of your arteries. Vitamin K2 activates proteins that guide calcium into your bones, where it belongs, and keep it out of your arteries, where it causes damage. Thomas had been taking high doses of vitamin D for years without K2. That extra calcium was slowly depositing in his arteries, making them stiffer and driving his blood pressure higher. The supplement that should have helped him was quietly accelerating arterial damage. The solution is simple. Always take vitamin D3 with vitamin K2, specifically the MK7 form. You need about 100 to 200 micrograms daily. Many supplements now combine D3 and K2 in one capsule. That's ideal. If you take them separately, take them at the same time. This prevents arterial calcification and, over time, can even help reverse it. Studies show that people who take D3 with K2 have better arterial flexibility, lower blood pressure, and better cardiovascular outcomes than those who take D3 alone. It is not optional. If you are taking vitamin D without K2, you need to add it today. Now, let's move to mistake number 4, and this one explains why so many people stay deficient for years despite taking vitamin D every day. Mistake number 4 is taking vitamin D without enough fat for proper absorption. Let me tell you about Patricia. She was 69 years old. Her doctor prescribed 2,000 IU of vitamin D daily after discovering her level was low. Patricia took it every morning without fail. Her breakfast was always the same: a piece of toast and black coffee. After a full year, her vitamin D level barely moved. It started at 22 and rose to just 28, still deficient. Her doctor doubled the dose to 4,000 IU. Another year passed. Her level reached 31. Better, but still not where it needed to be. Patricia was frustrated. She said, "I never miss a dose. Why isn't this working?" The problem wasn't her consistency, it was absorption. Vitamin D is fat soluble. It cannot be absorbed properly without fat. Patricia's breakfast contained almost none. Most of the vitamin D she swallowed passed straight through her body unused. But there's more to this than simply having any fat present. The type of fat matters enormously. New research shows that vitamin D is absorbed and functions best when taken with omega-3 fats. Omega-3s enhance absorption and reduce inflammation that can block vitamin D receptors. We changed Patricia's routine. She began taking her vitamin D with 1 tablespoon of fish oil each morning. The fish oil provided both the fat needed for absorption and the omega-3s that work in harmony with vitamin D. Within 3 months, her level jumped to 58. Her blood pressure, which had been stuck at 152/90, dropped to 136/82. If you can't tolerate fish oil, alternatives include a handful of walnuts or a tablespoon of flaxseed oil. You need omega-3 fats. Taking vitamin D with random fats from meals, especially omega-6 heavy vegetable oils, does not work nearly as well. If you are swallowing vitamin D with water, you are wasting most of it. If you take it with a low-fat meal, same problem. 1 tablespoon of fish oil or a handful of walnuts every day can double your absorption. Now we come to mistake number 3. This one is shocking because it involves the form of vitamin D most doctors prescribe. Mistake number 3 is taking vitamin D2 instead of D3. Let me tell you about Robert. He was 68. His doctor found his vitamin D level was 16 and prescribed 50,000 IU once per week. Robert followed instructions perfectly for 6 months. His level rose to 32, technically normal, but his blood pressure stayed the same at 158/94. His doctor was puzzled. Your vitamin D is normal now. It should have helped. What neither of them realized was that prescription vitamin D is almost always vitamin D2, also known as ergocalciferol. It is synthetic. It's used because it can be patented. Vitamin D3, cholecalciferol, is the natural form your skin produces from sunlight. Research shows D3 is about 5 times more effective than D2. It stays in your system longer. It binds more strongly to receptors, and for blood pressure, it produces far greater cardiovascular benefits. People taking D2 show little improvement in blood pressure, even when their levels normalize. People taking D3 experience significant reductions. We switched Robert from prescription D2 to over-the-counter D3 at 5,000 IU daily. Within 2 months, his level reached 62. Within 3 months, his blood pressure began falling, 146/88, then 138/84. After 6 months, his average was 132/78. His doctor reduced one medication. Check your bottle. If it says ergocalciferol, that's D2. If it says cholecalciferol, that's D3. You want D3. They are not the same. The research is clear. D3 is vastly superior for cardiovascular protection. And now we move to mistake number 2, the one that keeps most people from ever reaching the level where vitamin D can truly help their heart. Mistake number 2 is taking too low a dose to reach the blood levels required for real cardiovascular protection. Let me tell you about Margaret. She was 73. Her doctor found her vitamin D level was 20 and prescribed 1,000 IU daily, the standard dose. Margaret took it faithfully for an entire year. Her level rose to 34, technically normal. Her doctor told her, "Your vitamin D is fixed now. Good job." But Margaret's blood pressure did not improve at all. It stayed at 154/92. She was confused. She had read that vitamin D helps blood pressure. Why wasn't it helping her? Here is the truth. The doses most doctors prescribe are based on guidelines for bone health. They are meant to prevent rickets and osteoporosis. They are not designed for cardiovascular protection. The optimal vitamin D level for heart and blood vessel health is higher than what is needed for bones, much higher. The research shows that meaningful blood pressure reduction occurs when vitamin D levels reach between 50 and 70 nanograms per milliliter, not 30, not 35, 50 to 70. To reach and maintain that range, most people need between 4,000 and 6,000 IU of vitamin D3 daily. Some people need even more, depending on body weight and absorption. Margaret's level of 34 was fine for bones, but far too low for her heart. We increased her dose to 5,000 IU daily, taken correctly with omega-3 fats and vitamin K2. Within 3 months, her level reached 58. Her blood pressure began to fall, 144/86, then 138/82. After 6 months, she averaged 132/78. The research is clear. When people raise their vitamin D levels from deficient below 30 to optimal between 50 and 70, their systolic blood pressure drops by an average of 8 to 12 points. But this only happens in that higher range. If your level is stuck at 32 or 35, you will not see these cardiovascular benefits. Most people simply are not taking enough. The only way to know what you personally need is to test after about 3 months of supplementation. If you are below 50, increase your dose. If you are above 70, reduce slightly. Find the amount that keeps you in that optimal window. Now we arrive at mistake number 1, the most common, the most dangerous, the mistake that can completely cancel every other effort you make with vitamin D. This is the error. almost everyone makes. Mistake number one is taking vitamin D in the morning instead of at night. Let me tell you about Harold. He was 74. His doctor prescribed vitamin D for deficiency. Harold did everything right. He took D3, he took it with food, he added K2, he increased his dose to 5,000 IU. His level reached 56. Perfect. But his blood pressure did not change. It stayed at 162/96. Even on 3 medications, nothing improved. Then Harold joined a research study. He was assigned to take his vitamin D at night instead of in the morning. Same dose, same form, same K2, same fat. Only the timing changed. Within 8 weeks, his blood pressure began to fall. 152/90, then 146/86. After 3 months, he averaged 138/82. One medication was reduced. After 6 months of nighttime dosing, Harold averaged 128/76. 2 of his 3 medications were reduced. What changed? Timing. Vitamin D influences your circadian rhythm, your internal 24-hour clock. When you take it in the morning, it signals your body that it is time to be alert and active. It activates your sympathetic nervous system. Stress hormones rise, heart rate increases, blood vessels constrict, blood pressure goes up. That is normal during the day. But when you reinforce that signal every morning, your body never fully shifts into nighttime repair mode. Your nervous system stays partially activated even at night, and your blood pressure does not dip the way it should during sleep. Normally, blood pressure should drop by 10 to 20% at night. This dipping is critical for heart health. Without it, the risk of heart attack and stroke rises sharply. Morning vitamin D disrupts this process. Nighttime vitamin D restores it, and that difference changes everything. The research showed something remarkable. People who took vitamin D in the morning had almost no meaningful reduction in blood pressure over time. The average drop was less than 2 points. But people who took the exact same dose at night experienced average reductions of 10 to 14 points. Same vitamin, same dose, same blood level. Only the timing was different, and that timing made the difference between vitamin D doing almost nothing and vitamin D working like a true blood pressure medication. Those who took it at night showed healthy nocturnal dipping. Their blood pressure dropped during sleep the way it was supposed to. Their hearts and arteries finally got a chance to rest. Over several years, these people experienced 30 to 40% fewer cardiovascular events, fewer heart attacks, fewer strokes, less heart failure. That is not a small effect. That is life-changing. This is why Harold's blood pressure never improved, even though he did everything else correctly. He was taking vitamin D at the wrong time. Morning dosing kept his sympathetic nervous system activated. It prevented proper nighttime recovery. His blood pressure stayed elevated around the clock. The moment he switched to nighttime dosing, his body finally aligned with its natural rhythm. His blood pressure began to fall. His medications could be reduced. Now you understand why timing is so powerful. You also understand how these mistakes stack on top of each other. Taking the wrong form, using too low a dose, skipping K2, taking it without omega-3 fats, and then taking it in the morning. Any one of these can weaken the effect. But mistake number one can completely erase it. That's why so many people say vitamin D didn't help them. They were taking it the way the bottle told them to, in the morning, with breakfast, and unknowingly blocking its cardiovascular benefit. Let me now give you the complete protocol, the gold standard for using vitamin D to support healthy blood pressure. First, the form. Use vitamin D3, not D2. Check your bottle. It should say cholecalciferol. Second, the dose. Most people need 4,000 to 6,000 IU daily to reach optimal cardiovascular levels, not 1,000, not 2,000. Third, the cofactor. Take vitamin K2, 100 to 200 micrograms daily in the MK7 form. This protects your arteries and directs calcium where it belongs. Fourth, the fat. Take your vitamin D with omega-3 fats. 1 tablespoon of fish oil, cod liver oil, or a meaningful alternative like flaxseed oil or walnuts. Fifth, the timing. Take everything at night before bed. Not in the morning, not at lunch, not with breakfast. Make it part of your bedtime routine. Brush your teeth. Take your D3, your K2, and your omega-3. Then go to sleep. This allows vitamin D to work with your circadian rhythm instead of against it. Sixth, monitoring. After 3 months, have your vitamin D level checked. You want it between 50 and 70. If you are below 50, increase your dose. If you are above 70, reduce slightly. Seventh, tracking. Measure your blood pressure at home, morning, and evening for the first few weeks. Keep a log. Most people begin seeing changes within 8 to 12 weeks. Eighth, medication adjustment. As your blood pressure improves, talk with your doctor about reducing medications. Never stop on your own. Always work with your physician. This approach often allows people to reduce or even eliminate one or more blood pressure drugs. Let me tell you about Susan. She was 72. Her blood pressure averaged 156 over 94 on 3 medications. Her doctor wanted to add a fourth. Susan asked for 3 months to try this protocol. She switched from morning D2 to nighttime D3. She added K2. She added fish oil. She increased her dose to 5,000 IU. 3 months later, her vitamin D level was 62. Her average blood pressure was 138 over 84. One medication was reduced. After 6 months, she averaged 132 over 78. A second medication was reduced. 1 year later, Susan maintained healthy blood pressure on just one low-dose medication instead of the four her doctor originally planned. This is what happens when vitamin D is used correctly. This works. The research is overwhelming, but it only works when every piece is done correctly. The right form, the right dose, the right partners, the right timing, the right monitoring. Miss even one of these, and you will not see the full benefit. There are a few safety notes you need to know. Vitamin D at these doses is safe for most people, but if you have kidney disease, sarcoidosis, or certain rare medical conditions, you must talk with your doctor before using higher doses. If you are on blood thinners, ask your doctor before adding vitamin K2. Most people can use this protocol safely, but these are important conversations to have. The bottom line is simple. Your vitamin D may be completely ineffective for blood pressure control because you are making one or more of these 5 mistakes. Taking it in the morning is the biggest mistake. It eliminates most of the cardiovascular benefit. Taking D2 instead of D3 gives you minimal protection. Using too low a dose keeps you from ever reaching the level where vitamin D can help your heart. Skipping K2 allows calcium to harden your arteries. Taking it without omega-3 fats wastes much of what you swallow. Fix all 5 and vitamin D becomes a powerful blood pressure tool, as effective as medication, free of side effects, costing pennies per day, working every single night while you sleep. Harold's blood pressure dropped 34 points. Robert's dropped 26 points. Margaret's dropped 22 points. Susan avoided a fourth medication and reduced 3 medications down to 1, all from taking vitamin D correctly instead of the way they had been taking it for years. If this gave you information you can use immediately, share it. Send it to anyone you know with high blood pressure. Think about how many people are swallowing vitamin D every morning right now, taking the wrong form, missing K2, not absorbing it properly, and getting no cardiovascular benefit at all. This information could change their lives. Subscribe to this channel because the mission here is simple: evidence-based strategies that improve health without adding more medications. Practical tools you can use at home. And leave a comment. Tell me, were you making any of these 5 mistakes? Are you going to switch to nighttime dosing? Your experience could help someone else take control of their health. Thank you for watching. I'll see you in the next video where we continue learning how to protect your heart, your blood vessels, and your future.